Can germ cell tumors spread beyond the pineal region? Imagine a tumor starting in the tiny pineal gland deep inside your brain. Can it stay there, or does it have the ability to move beyond that spot? When it comes to germ cell tumors in the pineal region, they can indeed spread beyond their original location, but mostly within the central nervous system. These tumors are known to be aggressive and can invade nearby tissues or travel through the fluid that surrounds the brain and spinal cord. Germ cell tumors in the pineal region, especially germinomas, develop from germ cells that got misplaced during early development. They tend to grow in midline structures of the brain like the pineal gland and the area just above the pituitary called the suprasellar region. Because these tumors are not contained by a capsule, they can invade neighboring brain tissue quite easily. The main way these tumors spread is through the cerebrospinal fluid, which is the clear fluid that cushions the brain and spinal cord. Tumor cells can shed into this fluid and travel along its pathways. This can lead to what is called drop metastases, where tumor deposits appear in the spinal cord or other parts of the brain downstream in the fluid flow. They can also spread along the lining of the ventricles, which are the fluid-filled spaces inside the brain, or the membranes covering the brain and spinal cord, known as the leptomeninges. While it is possible for germ cell tumors to invade nearby structures directly, this is less common than spreading through the cerebrospinal fluid. About 5 to 10% of patients with pineal germinomas already have evidence of metastasis in the cerebrospinal fluid at diagnosis. Leptomeningeal spread can happen, especially if the tumor is left untreated or grows rapidly. Although spread through the blood is possible because the pineal gland is outside the blood-brain barrier and near large veins, it is quite rare for these tumors to metastasize through the bloodstream to other parts of the body. Because of the potential for spread within the central nervous system, treatment often involves radiation therapy that targets both the primary tumor and the entire brain and spinal cord. Chemotherapy is also commonly used to help control the disease. Surgery is usually limited to biopsy or managing complications like hydrocephalus, which is fluid buildup in the brain. In summary, germ cell tumors in the pineal region can spread beyond their original site within the brain and spinal cord, mainly through cerebrospinal fluid pathways. They rarely spread outside the central nervous system. This pattern of spread highlights the importance of early detection and comprehensive treatment to prevent or control metastasis. If you or someone you know is dealing with a pineal tumor, it's essential to work closely with a team of specialists who can tailor the treatment plan to the individual's needs. Always consult healthcare professionals for personalized advice and care.